Okay. Well, welcome and thank you for joining us for our webinar, Careers in Health Education, as we celebrate National Health Education Week. My name is Melissa Opp from the National Commission for Health Education Credentialing, and myself and Jess Wessner will serve as your moderators for today's event. Before we get started, I'd like to go over a few housekeeping items so you know how to participate fully in today's event. We've taken a screenshot of an example of the attendee interface. You should see something like this on your own computer screen in the upper right corner. All participants are muted throughout this event. You're listening in your computer's speakers, and this is by default. So if you would like to call in by phone, just select telephone in the audio pane and the dial information will be displayed. You will have the opportunity to submit questions to today's panelists by typing your questions into the question pane on the control panel. You may send in your questions at any time during the presentation, and Jess will be collecting those questions and we will address those during the Q&A session towards the end of today's presentation. This presentation is being recorded and will be available on MCHES YouTube channel by next week. So a little bit about MCHES. The mission of our organization is to enhance the professional practice of health education by promoting and sustaining a credentialed body of health education specialists. To meet this mission, we certify health education specialists, promote professional development, and strengthen professional preparation and practice. We are recognized for granting and maintaining two credentials, the Certified Health Education Specialist, or CHES, and the Advanced Level Certification, the Master Certified Health Education Specialist, or MCHES. We are really excited to be celebrating our 30th anniversary this year. For 30 years, we have been building on our history and accomplishments to support our mission and help us achieve our goals as we stay committed to quality standards and best practices in the health education profession. So what does the acronyms CHES and MCHES signify after somebody's name? This validates the comprehensive qualifications of one's academic background and work experience, specifically in health education. It requires that one must stay current in the field by receiving continued professional development. In our case, it's 75 hours and 5 years. It confirms through a rigorous exam process that one has mastered the knowledge and skills of the health education and promotion profession. And lastly, complies with national and international certification standards. So individuals that hold the CHES and MCHES certification do work in a variety of different practice settings. They're working in healthcare, doing patient education. Many work in government, which includes county, state, and federal health departments, some military organizations, many community and nonprofit organizations, business and work site, so doing work site wellness for insurance companies and other wellness companies, schools working in K through 12 doing health education, and university settings, some working on campus wellness programs. Our panelists today come from many of these different sectors, and we will hear about their roles as CHES and MCHES and what they're doing in these different practice settings. So I would like to introduce our four wonderful panelists today. We have Deniece Chevannes, who is MCHES, and she is the Director of Health Promotion and Evaluation with Hemophilia of Georgia. We also have Janesia Robbs, who is MCHES, and she's a Health Communication Specialist on the Communication and Public Engagement team at the U.S. Food and Drug Administration. we have Chase Messersmith, who's CHES, and he is a community health educator with Community Health Network. And lastly, we have Jeana Neu, who is CHES and the principal of New Funding. So I'd like to welcome our 4 panelists today. So what we're going to do is we have a series of questions prepared that we're going to ask the panelists, and we're going to do in a roundtable format and have each panelist respond to those questions. And just a reminder, if you do have any questions for our panelists, please type them into the message chat, and we'll be fielding questions during our Q&A. So our first question: what is your current job title and sector of practice? And we're going to start with Chase.
All right, thank you for the opportunity to serve as panelist for today's webinar. Again, my name is Chase Messersmith, CHES, and I serve as a community health educator. That's my title, and with Community Health Network. It's a large healthcare system in Indianapolis. And the sector of practice that I'm currently in falls in the healthcare and community and nonprofit. Thank you.
Wonderful. Next, we'll hear from Janesia Robbs.
All right. Good afternoon, everyone. Again, my name is Janesia Robbs, and I currently serve as a health communication specialist at the U.S. Food and Drug Administration, also known as the FDA. I work in FDA's Center for Food Safety and Applied Nutrition on the communication and public engagement team. So I'm in federal government working on communication and public engagement as the sector. Thank you.
Wonderful. Next, we'll hear from Gina. What is your current job title and sector of practice?
Morning. Yes, my title is Principal and Founder of New Funding. I'm in private practice. It's a consulting practice dedicated to bringing awareness and funding to public health-oriented nonprofit organizations.
Great, thanks Gina. And next, Deniece.
Good afternoon, everyone. As was mentioned, I'm Director of Health Promotion and Evaluation at Hemophilia of Georgia, and we work in the field of hematology to ensure patients have access to care while actively pursuing a cure through research funding. But we also partner internationally to build the capacity of the poorest countries to improve and sustain care for people with inherited bleeding disorders around the world. Very excited to be with all of you today. Thank you.
Great, thanks, Deniece. So our next question is, how did you arrive at your current position, and what was your career path after graduation? So this time we'll start with Janesia Robbs.
All right, thank you. So I graduated from Morgan State University in Baltimore City, Maryland with a Bachelor of Science in Health Education. And then after I graduated, I landed a job at the Baltimore City Health Department, and I worked part of my time as a health educator in a teen and young adult reproductive health clinic, and the other half of my time as a community organizer for a youth after-school program. I loved what I was doing at the time. I loved working with so many young people in the schools, clinics, and the community. And after about 3 years working in the teens and young adults program, I was offered an opportunity to also work on a new initiative within the health department's maternal and infant care program. There, I worked on the Be More for Healthy Babies initiative as a health educator. And at that time, the initiative hadn't launched yet. So I had a chance to join the communication development team for the initiative, where I worked on the creation and testing of communication materials, which included commercials, educational videos, stakeholder toolkits, and a trainer-trainer curriculum. And it was that experience and me completing my master's degree in public health that led me to the next position, which was a health communication specialist within FDA's medical device program. So I worked in medical devices for about 4 years, and then I moved over to FDA's food program, and there I was a member of the public engagement team. So in my current role, I strategically plan and execute outreach efforts and communicate with external stakeholders on various food safety and nutrition issues. Thank you.
Wonderful. Thank you, Janesia. Next, we'll hear from Gina. Gina, we're not hearing you. You might be on mute.
Oh, I'm so sorry.
That's okay.
Talking without anyone being able to hear you, that's not. So, in describing my career path, while I was studying health promotion and education in grad school at the University of Utah, I was fortunate enough to work with a graduate advisor on large federal grants that had an international purpose in health research. And at the same time in grad school, I actually founded a small nonprofit called Eat Awesome Things at School. And I immediately saw that putting grants into work, you could fund programs such as cooking classes and taste tests and school gardens. And I was even able to fund entire programs with staffing. So when I graduated from my master's, and I had no intention of going this route, but I realized I could launch my own consulting practice in funding development. I found that it was a much better way to reach more people than working individually. And I focused my nonprofit on public health missions because my passion is to improve the health of entire communities.
Wonderful. Thank you, Gina. Next, we'll hear from Denise. How did you arrive at your current position, and what was your current path after graduation?
I like to say that health education found me. My bachelor's degree is actually in Spanish, and I started out my career as an interpreter for a GYN clinic at a safety net hospital. But pretty soon the patients were telling me more than they were telling the doctors. And I realized that most of their issues could have been prevented with some health education. To be honest, the first few months of that job, I spent more time having informal education sessions in the waiting room than I did interpreting. The manager of the program asked me if I would consider offering formal health education classes, and that's where my career in health education started. I got my master's in community health education and became a certified CHES. From there, I started working at a nonprofit focused on teen pregnancy prevention and positive youth development. And then I pursued my CHES certificate, my MCHES certification. After that, I did a fellowship at the National Center on Birth Defects and Developmental Disabilities at CDC. And that's where I learned about hematology. And that led me to my current position, working at a nonprofit focusing on benign hematology nationally and internationally.
Great. Thank you, Denise. And last, we'll hear from Chase.
Yeah, thank you. So upon graduating, I'd like to explain my career path. I started working as a health educator, reaching out to employers about all various types of health education, including diabetes, sodium reduction, obesity, physical activity. And upon then, I realized that I wanted to transition into more community work, and that's where I landed a job at the Purdue University Extension as a community wellness coordinator, working on all things from food safety, food security, food resource management, and physical activity. So it was really the community determining the things that they wanted to work on and highlighting the needs and the interest in the community. And that was a supplemental nutrition assistance program, and that was funded through the education portion of that. And then I transitioned into where I am today. And as I look back on the steps that were taken to arrive where I am today, I really think that these previous positions and internships that I even had when I was acquiring my undergraduate degree served as a great personal and also professional learning opportunity. I feel like these opened the doors for opportunities and gave me better understanding of how I can best contribute in the public health field.
Great. Thank you, Chase. That's wonderful. Our next question for our panelists is, what does an average workday look like for you? And we're going to start with Gina.
So an average workday for me can vary quite a lot, actually. Since I work from home, my day can be between working on current grant projects and writing all day, or I can be out meeting with clients in the community. But as a whole, right now I'm working on two major projects. One's a capital campaign in Salt Lake City for a new opioid treatment facility. And the other big project I'm working on is an annual songwriters festival that's very similar to our Sundance Film Festival. However, it has a song and musical note to it, and it's dedicated to reducing mental illness, suicide, and addiction and abuse in the music industry, which has the highest rate of those disorders. And since I work remotely, I schedule my own time. Sometimes I'm writing until 2 in the morning, and other times I'm out of state and working remotely. And I find funding involves assessment, program planning, and implementation, all the things that we learn in health education. And I work with my clients to develop the programs that they're going to need that help them have the best opportunity to receive funding. I find one of the key things I have to do is translate programs into telling stories. And I write a tremendous amount. I probably write 20 to 30 hours a week. And I also work with our state legislators and funding agencies, and I'm constantly networking for new potential clients, and I'm always digging for other funding opportunities. Pretty much half my time is spent doing that as well. And I also attend various conferences and workshops, and I also present at various conferences across the state and the nation to stay current on all the things happening in this profession.
Great, Gina, thank you. Very interesting, very interesting. Denise, next we'll hear from you. What does an average work day look like for you?
I'm fortunate that I love what I do, and I get to travel to do it. On an average day, I'm usually working with partners, locally and internationally, developing logic models, evaluation plans, designing programs, and coming up with implementation strategies. I might start the day in English and then have a conference call in Spanish, switch to a different language, discuss with our partners how to best advocate to get buy-in for a program or build relationships with the Ministry of Health, work with youth to empower them to also take leadership roles in the programs that are being planned. It's never boring at work, which I love.
Great. Yes, doesn't sound boring at all. All right, Chase, next we'll hear from you.
All right, yeah, thank you. So my typical day is different throughout the week, and that's something that I love and also boast about to family and friends. It's really just regularly attending community meetings out in the community that I serve, and working with a variety of different community stakeholders on the different projects that I'm working on for my role. So I serve as a community health educator, like I mentioned, on the racial and ethnic approaches to community health program, which is the one of the only CDC programs that explicitly focuses on reducing chronic diseases for specific racial and ethnic groups in urban, rural, tribal communities with high disease burden. So I'm working also out in the community with a variety of different clinics, setting up a produce prescription program, working with it's called the Community Cupboard of Lawrence, which is a food pantry that is funded by the community as well as the Community Health Network where I work. So each day can look drastically different, and it's really something that I love, and it really just adds excitement and not knowing what maybe the next day might look like because it's different from today. So it really looks different, and it's really a lot of networking and building relationships and communicating with those stakeholders.
Good, good. Thank you, Chase. And lastly, we have Janesia. What does your average work day look like for you?
Thank you. So the interesting thing about my job, like many of the other panelists have said, no day is the same. When I walk into work, I could be preparing for a stakeholder coalition meeting with senior leadership and key stakeholder groups, or moderating several stakeholder calls with industry, consumer, and public health groups. And that could be either to walk them through a recent food safety or nutrition announcement, or just to plan the next coalition meeting, or just to touch base with them to see, how they're doing and if there's any issues or concerns or questions that they may have of us. I could also be headed to a large meeting venue like a hotel to manage a public meeting and interact with key stakeholders that are in attendance. And then on a day where I don't have an actual event scheduled or no meetings, I will typically be drafting stakeholder meeting notes or uploading attending lists and cleaning up our stakeholder database. And, generally speaking, as a member of the public engagement team, I'm responsible for strategically planning and executing outreach efforts, communicating with external stakeholders, managing stakeholder meetings, and providing forums for stakeholder perspectives to be heard, including the coordination, like I mentioned before, public meetings and other events for FDA and stakeholders. And then I also am in charge of the routine meetings, several routine meetings that we have with our consumer and industry groups. So that's kind of what my time looks like on any given day.
Wow. Sounds like a lot. All right. So we're going to move to question 4. I just want to remind everyone, too, if there is any particular questions you have for our panelists, please type those into the queue so we can ask the questions to our panelists once we get to that portion of the webinar. So on to question 4, what do you love most about your job? And we're going to start with Deniece this time.
I love most. At the end of the day, what I love the most is that it doesn't matter what language I'm speaking or where I'm physically located. I'm working to empower people to improve their health outcomes and to take leadership in strengthening their community. So I get to pass on what I have learned as I've grown my career. I also get to mentor and grow the next generation of emerging youth leaders that are going to change the world. And as a bonus, I get to travel, eat fantastic food, and create friendships around the world.
Great. What's not to love about all that? All right. Next, Chase, what do you love most about your job?
Yeah, so I talk about my job, things that I love. I really love the ability to provide resources, programs, education, and positive change to improve the lives and livelihoods of the community. Just to kind of piggyback on what Deniece said, it's really just providing that education that I was provided and carrying it on and providing that to assist in helping others. And I really kind of talk about the helping others. I really find personal and professional happiness in helping others become happier. And as I put job in parentheses, because it's not necessarily a job most days, except for reporting sometimes, but that can get tedious. But it really allows me the opportunity to work at doing something that I love each and every day, and really just building relationships and partnerships out in the community that I live in. So I think that's important. So it's not when I'm at the office and, even on the weekends, if I'm at the grocery store, it's seeing those community members that I've built that strong relationship with and seeing them thrive and seeing them improve their health. So that's something that I really love.
Yeah, very nice, Chase. Thank you. Janesia, we're up to you. What do you love most about your job?
Thank you. The thing that I love most about my job is the diversity of responsibilities. As I mentioned before, no day is the same. I'm never bored at my job. There's always something interesting going on, whether it's an interesting topic or an interesting challenge that we need to address. I also love the fact that I get to work directly with our stakeholders who represent industry, consumers, public health professionals, other government agencies, and we're talking about an issue that affects everybody. So that's really what I wanted to do in moving to this position. I also like that there are opportunities within my job where I can be professionally and personally stretched, meaning that I can work outside of my comfort zone, and I'm learning like new skills every day, specifically for me, like facilitating and moderating large scale meetings and things like that, which are new to me and things that I don't, necessarily want to do, but I know I need to do them. And I'm, more I do it, I'm pretty good at them. So, so I love most things about my job. Thank you.
Great. Thanks, Janesia. And last, we'll hear from Gina. What do you like most about your job?
Well, three things come to mind. As I think about my job, I really enjoy being able to impact whole communities through increased funding for health-related programming. I also like using writing as a form of health education to influence funders to support important public health causes. And then lastly, can't help but saying I really love the flexibility of owning my own business and being able to work remotely, being able to travel and work from anywhere, and also be able to raise my family in the way that I would like to be able to. So those are the most important things I love about my job.
Great. Wonderful, Gina. Thank you very much. Okay, and then I think we're going to move on to our last question for our panelists, which is, what advice can you give to young professionals seeking to enter the field of health education? So Chase, we're going to start with you for this one.
Yeah, so as I was thinking about this question, I just jotted down a few things that I would have liked to know, and things that I think will be beneficial. So just to start, the first thing is accept the internship, the job that is out of your comfort zone or different from the typical public health position. I really think there's always ways to incorporate health education into everything that we do, and those experiences will serve as an opportunity to grow. So I grew up in rural Indiana, and after my first year of college, I was looking for an internship and was offered a position to work in the agriculture industry. And really, I think that internship helped me grow in so many different ways upon communication and finding ways that we incorporate health education into the agriculture industry, because that's where a lot of my family works. So I think that was something that allowed me the opportunity to really grow in so many different ways. Always stay connected to the previous coworkers, professors, classmates, and friends in the field, because you never know when you'll cross paths with them again in the future. This is something that I was, guided to do, is every time you leave a job, or even, if you've been with a position for a little while, ask for a reference letter, just so that you can use that in the future. And I recently accepted this position back in April, from the previous position at the extension office, and I was able to reach back out to those that I still had a relationship with, checked in with, followed, and was connected with on LinkedIn and different opportunities in that sense. And also never stop learning and connecting. The public health field is a special field just because there's so many opportunities to learn, and there's different areas to expand your horizons and also get out of your comfort zone. That's something that's I've really tried to do over the last couple of years, just to get out of that comfort zone, so I'm able to learn various tactics in my position, and really encourage your employer to fund continuing education and certifications. That's something that was important, and also allowed me the ability to get the my CHES certification to sign up for the exam was funded by a previous employer, just as something that I recommended to them. So that's something I really think is important. And even those continuing education credits, some of your employers will assist in paying for those. So, and really just communication relationships are important. Just maintaining those relationships with someone. If you're out in the community working in the public health field, just make a note of someone's, like if they said that their daughter plays baseball, just really following up with them on, the relationship side, because, we all have families, and those relationships are really gonna, they allow you the ability to, strive in this field. So that's a strong foundation to this field.
Great, Chase. Those are some great tips for those on the call or the panel. Okay, next we'll hear from Janesia. What advice can you give to young professionals seeking to enter the field of health education?
Thank you. My biggest advice that I often give to young professionals seeking to enter the health education field is to have an open mind, be willing to take on new challenges and responsibilities. For me, I never thought that I would be working as a health communication specialist or even working at FDA and actually enjoying, what I was doing. I didn't know FDA had opportunities for health educators. I just didn't know. I wasn't aware. So I got to where I am by just saying yes to opportunities. And I also believe that as a health educator, we are equipped with many skills. And I think Chase was saying this also, we have many skills that lend themselves very nicely to other things and other job titles. So don't be so narrow and you're looking for career opportunities. Open that net a little wider, because as a health educator, you can do health communication specialist. You can look for jobs that have like program manager, program analyst, public health advisors, consultants, media specialists. You can become entrepreneurs. There's so many things that you can do with those skill sets that you have as a health educator. And I would also suggest that young professionals be open to doing more. So sometimes, that includes more learning, more hours at the current job that you're at, more effort, more impact. And you're also doing those more things for less. So you're doing more with less resources, sometimes less pay, less available time, or less time to do the stuff that you want to do, like socially. But over time, I think it will be beneficial, and you will have more experience than your counterparts who have not chosen to do kind of the more with less. And you never know where doing more will lead you. And in my personal, in my case, doing more has led me to where I am today. Thank you.
Well said, Janesia. Thank you. Next, we'll hear from Gina. What advice can you give to young professionals seeking to enter the field of health education?
That's always a good question, and I wish someone had given me a lot of advice on that when I was first starting out in the field. And I really liked what Chase had to say. Basically, think outside the box. Don't just fall into the traditional health education roles, the health educator roles in the government. I found, one, those were difficult jobs to get. They're highly competitive, and they don't really have the diversity that so many other positions might have. And you can invent your own career, such as what I did. You need to be willing to try out different things and have an idea of what you might want to go into and start doing that early in school. Don't think you need to wait until you graduate before you start working in health education. I did several internships. I worked with the University of Utah's Public Health and Public Relations Department, and I traveled with a tour of Utah across the state for several years, which gave me a unique set of circumstances. And I also worked with incoming refugees, just trying out different roles in the health education field. If you do decide to work for yourself and start your own career, which of course I would highly recommend looking into, but if you do that, realize that you might be going out without income for an unforeseen amount of time as you build that business and grow your clientele. I didn't start making money for the first 2 years of working in this industry as I proved my skills. Working for yourself also means sustaining yourself. I need to pay for my own health insurance, my own continuing education, my own marketing. If I take a vacation, it's without pay. And what you put into your own business, you get out. The pros, though, of working for yourself is everything I do builds myself. I set my own schedule, I determine the impact that I'm going to make, and how I'm going to go about picking clients that I want to work with. So if you do that, think of those two different ways. And if you have any other questions, I'd be happy to answer them individually.
Great insight, Gina. Thank you for that. And last, we'll hear from Deniece. What advice can you give to young professionals seeking to enter the field of health education?
I wholeheartedly agree with my fellow panelists. The field of health education gives you so many options on how to practice. I would say find your passion. I started on direct patient services, but then I realized that I had to work at the systems level to make sustainable change. So for me, as Chase said, certification was a path to grow my career and a path upward. It's important to stay current, continue to grow, continue to learn. It doesn't matter if you're trying to secure funding or you're getting buy-in from stakeholders, or you're deciding data collection tools. Learning and developing the skills in the 7 areas of responsibility has given me such an essential foundation to be an impactful health educator. So I would say learn your craft, build your skills, be flexible like everybody else has said, try new things, and always remember that for change to be sustainable, the community has to be at the table helping to create that change. Thank you.
Great. Wow. That's some great advice from our 4 panelists, so thank you. Next, I think we can turn over to the Q&A portion. Jess, I'm going to turn this over to you. Hopefully we've gotten some questions from our attendees to ask to the panelists.
Yes, we've gotten quite a few, actually. Can you hear me okay, Melissa? Awesome.
Yes,
okay.
yes.
All right, I'll start with the first question. It says, I work as a CHES educating expectant mothers and their families at hospitals in a large healthcare organization. I feel like I am less respected because I'm not a nurse or physician. So how can I assert my value to the organization and advocate for the importance of filling the need for patient education?
This is Deniece. I used to work at a hospital, so I understand all about building relationships with the clinical team. One of the things that I did was align myself with the clinical outcomes we were hoping as an organization to provide in our patients, and really work with the clinicians to design those, so that while they were concerned with clinical outcomes, I always reminded them that these clinical outcomes had to be translated to actual work with the community. And I brought the voice of the community to the table, even if they couldn't. And that proved the value, because it doesn't matter how much of a great plan a nurse or a doctor has if the patient is not going to follow it. And I think as health educators, or we fill in that role, we can create that link between the patient and the doctor and find that happy medium for the patient to actually implement some of the recommendations from the doctor, and for the doctor to think outside the box on how they recommend some education and follow-up and protocols for the patient. So I think we play an essential role in improving that relationship, and we have a skill set that we can bring to improve the clinical outcomes. I hope that helps.
Yeah, that was excellent. Thank you, Deniece. Next question was from Jasmine, and she asked, when starting out your career, how did you market your CHES or get employers to see why it's of value?
This is Janeshia, but so when I started my career, I just so happened to get a position with Baltimore City Health Department as a health educator. So when they saw that I had that CHES, that gave me the extra, the extra push, I guess, to get that interview, because they assumed that I had the well, I had the education, but I had the knowledge base to do the job, and it was a hard job to do. So I think that it was a little easier for me because I was actually going into a health education role. So if you have that CHES well, at that time just CHES, but it just helped put me over the finish line. But I can imagine it being harder if you're not going into a health educator role, and maybe a different role in an organization that doesn't understand what health education is or what it does. So I just find myself to be, I guess I was in a better situation because they understood what a CHES was. I didn't have to explain it to them, and I didn't have to explain to them what the benefit of it was because they knew already. So yeah, I didn't have to experience that.
And I find, this is Gina, I find with having my CHES certification really gives me a little more clout with clients to let them know that I take my continuing education very seriously, and that I'm looking for that data and those references that I find so helpful when it comes to writing and proving the need for a funding opportunity or a program. I don't know that necessarily some of my clients understand the meaning behind it, but when I explain it to them, they certainly realize the importance of it, that's for sure.
Great. Okay, next question. I'm just going to summarize. It's from Miriam. She asks, can you give feedback as to what employers might be looking for on a health education resume? She's never had internships or opportunities to get her feet into the actual nitty-gritty, she says, of health education, and I feel like my resume is lacking. So do you have any ideas for sprucing up that resume?
Mm-hmm.
Yeah, this is Chase. I can elaborate on that a little bit. So I was in a similar position as I didn't really have any direct internship experience in the public health field. So I wrote up a document, just put some information together about some of my interests, and I was going to Purdue University, so the Purdue University Extension Office was located on campus, and that's something I just reached out to the Extension Office. I had different ideas of ways that I wanted to incorporate health education to their employees, and just wrote up a little script of different ways that I could implement a program, and just sent it off. Was just hoping for the best, but it actually bit. I got directed to the director of the extension. She directed me in the right way, set up an internship, and I had fulfilled my practicum requirements that way. So I think that's an opportunity, is really just putting your interests down, your vision, and just proving to them that this is something that you can do. You're willing to put in the time, the effort, kind of like what Janeshia said earlier, is just really putting that extra work in is really gonna get you those opportunities.
Mm-hmm. And this is Janeshia. I want to piggyback off of what Chase said. While writing down your interests and the things that you hope to do, or the areas of employment that you're looking for, if there's a community-based organization that's kind of doing it, and they have where you can volunteer for, say you're interested in, educating the public about heart disease or something, there should be a local American Heart Association or something in your community where you can volunteer to do maybe some patient education or some health fairs, things like that, where you can show that you are active in that community. You can gain some experience doing, programs. Of course, you will be, volunteer. You wouldn't be paid, but it could show a future employer like, oh, okay, you have practice in this and you're really invested in your community. So it may be a plus on your resume.
Awesome. I think in the interest of time, we'll take one more question. And this one was from a person who studied health education at the undergraduate level, graduated in 2015, completed an internship, but then got pulled into an unrelated field. And I think this happens a lot. You get out of school and you're hungry and you need, to take what you can get initially, but they want to get back, they want to jump back right into the field. What advice can you give to someone who wants to get back into health education after a few years gap of time?
I would say, this is Gina, I would say if you're wanting to get back into the field, make sure you're attending conferences and you're keeping up your continuing education, so that they're seeing that you're starting to stay current in that, because the health field changes quickly. I think that's one of the most important things. And then also be willing to take a role that may not be at the level you were at before, or do some volunteer work in the meantime, so that you can refresh yourself back into that field. Those would be some of my suggestions.
This is Denise. I think everything Gina said is absolutely on point. I also think that you should look at whatever field you're coming from, take apart those required skill sets that you're using there. Just like we all said on the panel before, the field of health education gives you so many options on how to practice. So there might be skills that you have learned or grown outside of the field that might be useful in the field. So really look at not your job title, but what you did. And can you take some of those skills and unpack them and repackage them in a way that they might be helpful for health education, and just think outside the box on that. Are they skills that you earned in this job that can be useful to a career in health education, and not just health education? I think MCHES puts together a really good list of titles related to health education, and just think of those titles and think of what it is required for that position. Do you have some of that skill set? Could you repackage it in a way that will give you that entryway, or at least repackage it so you could go find that volunteer opportunity that Gina mentioned?
Okay. Excellent. I think we're wrapping up the question portion. There were still some questions, so we're going to try and get those answered probably by email after the presentation. I'm going to turn it back over to Melissa at this point.
Sure. Again, I just want to thank our panelists. I think it's just fascinating to hear the wonderful work that's going on within our field, and kind of the different journeys and paths everyone has taken to get to where they are. And it's just wonderful to hear the passion that people have for their positions, and the love that they have for their jobs. So it's wonderful, and I want to thank the panelists again. We do have some career resources on the MCHES website. I think Denise alluded to the sample job titles. Everyone here has a different job title, so there are just so many job titles out there for CHES and MCHES. So I would take a look at that. And for those who are searching for jobs, kind of keep that in mind, that, there might be job opportunities out there, but they don't just say like health educator or health education specialist, that, you really might have to search, take a deeper dive into the search for different job titles out there. And we have, a number of other resources there. So I encourage you to check out our website under career resources. And just talking about employment opportunities, kind of like what some of the panelists said, maybe thinking outside the box a little bit when you're looking for employment opportunities, going on some national sites, like Indeed and Monster, and doing different types of keyword searches might help to bring up some open positions out there, and really, making your search a little bit more, specific when it comes to those different job titles. I do want to encourage everyone that we're going to continue our celebration of National Health Education Week, and we'll be doing a Twitter chat on Thursday at 12 noon, and we have some great partners joining us to continue the conversation about careers in health education. We're working with WebMD, Gina, the University of Central Arkansas. So I encourage everyone to sort of join our conversation as we, continue to talk about careers in health education. And then we have a number of social media platforms available as well. If you go on our YouTube channel, you're going to see some familiar faces. Janesia, Deniece, and Gina all were a part of our videos that we did back in the spring. So there are great resources out there that, just continue the conversation about, what people are doing with the CHES and MCHES certification and what they enjoy about their jobs, et cetera. So I encourage you to join our YouTube channel, and that's where Jess will be posting our recorded version of our live webinar will be on our YouTube channel. And we have a new Instagram page that we started at the beginning of 2019. So I encourage you to, if you're not already following us on one or more of our platforms. And I can't thank our panelists enough for their time and their wisdom and just sharing, what they do every day at their jobs and giving some great advice and insight to all of our attendees today. So I want to thank you to our panelists today for their time. And again, we'll have the webinar recorded on our YouTube page. So thanks everyone who attended. Happy National Health Education Week.
Thank you so much for having me.
Yes, thank you.
Yeah, thank you very much.